So the way that typically works is you go to sleep, we do oral sedation, and we do IV sedation. Now, when I say sleep, I gotta say that kind of like with the air quotes. So oral sedation, you're gonna be very relaxed, okay? That's the promise I can make you, because it's how your body is gonna metabolize the medication. There's no extra charge for oral sedation. I've been doing it, I'm licensed to do it for a very long time. It's very predictable. We actually just completed a pretty complex case yesterday with oral sedation. And sometimes it's easier if I just tell you, hey, open up a little bit bigger. I got to get back, all the way to the back for 30 seconds to make sure I can get this implant into the right location. Versus IV sedation, where the anesthesiologist comes to the practice. There's an expense to do that. We give you medications via IV, and you're, 100% out. So at that point, there's a big difference. I know a lot of you guys are scared about dentistry. I mean, granted, like if I'm in the chair, I don't like being there either. So we have IV sedation for you, and it's a very, logical thing to want to be 100% asleep, wake up like it feels like 5 seconds later, and have everything done. So we have that option for you, and we also have the oral sedation option for you. If economics are maybe an issue, there's some people who just don't want to be asleep for whatever reason. Like 1 out of 100 patients come in and just don't like the thought of IV sedation, and if that's you, then we have another option to keep you relaxed. You're still awake, you're still in control, but you're very relaxed, so you don't care about the procedure. You're not worried about it. You can turn off the analytic portion of your brain and just relax while we do the procedure. So we have a lot of different ways to get you from A to Z. I've never had anyone do oral sedation and not have a good experience with it in terms of being worried throughout the procedure. Typically, you remember me walking in the room, and then you'll remember kind of being done with the procedure. IV sedation, again, you remember me walking in the room, and then you remember us waking you up afterwards and telling you you did great. So the sedation options are an amazing aspect that we've incorporated into dentistry. We do sedations for people who have fear also, because fear can override a lot of this. And a lot of people are so scared about going to the dentist that's why your teeth get bad, because then you're only waiting for things to hurt, and then you got to call the dentist, you got to get in there. So we totally understand why you are where you are, but just know that if you're listening to this video, just know that we have solutions for you that are going to get you through the process. In dentistry, A, we've never had this much technology. B, we've never been as good as we are today. And C, our office we've made that dedication to technology. We've made the dedication to incorporating everything we can to keep you comfortable.